Hello, my name is Diane Neville, and I'm a clinical social worker at the Punxsutawney Area Hospital Counseling Center. And I'm here to talk to you today a little bit about anxiety and depression. Well, hasn't 2020 been quite the year for all of us? And it's no wonder that we've all experienced a little bit of heightened anxiety and depression, given the impact of the coronavirus, this negative political environment in which we're surrounded, the riots, the wildfires. And with women, under normal circumstances, women are impacted by anxiety and depression more than twice as much as men. And so, with everything that we have going on, it's only natural that women are really experiencing heightened anxiety and depression. After all, we're the caregivers for the family. We're in charge of making sure that our family stays healthy, we have adequate food, we have money to pay the bills, we are taking care of our elderly parents, our children's education, arranging childcare, all while trying to balance our own work schedules. It's an awful lot to deal with, and I think a lot of us are laying awake at night with all these things running through our minds. Now, anxiety is a normal response to stress. It's also the most common mental health disorder we have in the United States, and it affects nearly 40 million Americans each year. And women develop about 1 out of every 5 women have an anxiety issue throughout the year. Okay. Anxiety is a feeling of worry, excessive worry, and nervousness that can become very debilitating and just negatively impact every aspect of our life if it gets out of control. And it can also come on very suddenly for no apparent reason. Some of the causes for anxiety in women, this is one of the big reasons why it impacts us, are the hormonal changes, starting shortly before puberty and last well through menopause. Genetics can be run in our family, and it can also be a response to traumatic events such as domestic violence, physical, emotional, and sexual abuse. Some of the symptoms of anxiety are this extreme weakness. You have the shortness of breath, tightening in your chest, the muscle tension, rapid heart rate, hot flashes, dizziness, feel like you're going to pass out. And anxiety and depression both, they go hand in hand. A lot of times if you're having depression, you're also having the anxiety. Now, depression affects about 15 million Americans each year. And again, women are twice as likely to develop depression as are men, with 1 in 4 women developing major depression at some time throughout their life. The symptoms for depression, you have a persistent sadness. You feel empty, you have just a loss of interest in things around you, things that you used to really enjoy. Okay. You feel hopeless, helpless, worthless. You can be sleeping too much, not enough. It really takes everything you can get just to get out of bed in the morning. You can either be overeating or not having any appetite at all. And you can also be having thoughts of suicide, wishing you wouldn't wake up in the morning, or thinking that your family would be better off if you were dead. Again, some of the causes of depression, hormones. They play a big impact, as do genetics, traumatic events, and interpersonal stresses such as stress in a relationship, divorce, job loss, or death of a loved one. Some protective factors for both anxiety and depression are, number 1, having a sense of control over how you react or respond to a severe life event. Having access to material resources to help you be able to make better choices in how you respond. And maybe most important is having support from family, friends, and your healthcare providers. The treatment for anxiety and depression are both very similar, except a little bit of changes in the medications that are prescribed, but physical exercise is very effective. Get out and take a good brisk walk. The release of those endorphins just help us feel better. Also, meditation, mindfulness exercises, yoga, anything you can do to divert your attention away from whatever the situation is that's causing you the stress. And of course, deep breathing with a focus on counting the breath. Breathe in slowly through your nose to the count of 7, hold it for the count of 7, and exhale through your mouth to the count of 7. And again, focusing on the counting because that helps divert your attention a little bit. Okay. Of course, counseling is very effective, as is medication. A lot of times we will recommend a combination of counseling and the medication, at least to get through the initial part of the treatment. Now, I would be remiss if I didn't take a couple minutes to talk about postpartum depression, as that can be, a very serious disorder if it goes untreated. If you know a new mom, please pay close attention for any changes in her mood or her behavior. Offer support, take over some meals, go over and help take care of the baby or other children, to give the new mom a chance to go take a nap, take a shower, go have lunch with some friends, just to give her a little bit of a break. And also offer some reassurance that just because she is struggling right now, it doesn't mean that she's weak or that she's a bad mom. It just means that her body's going through some changes and that she needs a little extra support. And don't wait for her to ask for help, because she might not. She might be too embarrassed. Reach out to her. And also encourage her to discuss her feelings with her healthcare provider so that she can get the necessary help that she needs. Okay. If you are interested in any more information about these topics, or if you are interested in any services that we have here at the Counseling Center, please give us a call at 938-1830. We offer individual and group counseling, psychological testing, and medication management with our psychiatrist, Dr. Amaranini. Thank you very much.